3 women, 3 ages, all looking to take years off their faces. Their solution? Fillers. Bride-to-be Christine is in her early 30s and wants to freshen up her face for the big day.
This is kind of really exciting. It's a good time to be able to get this done.
Elaine is 53 and looking to lose the bags under her eyes and smooth out wrinkles.
There's times in the morning I'm looking at my face and I just can't believe it. It's who is that old woman?
And after having a facelift 7 years ago, 64-year-old Ellen hopes to maintain her new look.
Gravity is constantly pulling down, and I'm fighting against it.
Dr. Beth Collins says as we age, we lose fat in our faces.
This is the area I think that first of all is concerning a little bit to you.
Fillers work by restoring that volume. Today, she's using Juvederm and Voluma.
These fillers are what we call hydrophilic, which means that they gather your tissue fluid and the water that's in your own body, and it smooths it out.
Dr. Collins tailors each application to each face.
Because I see just a little bit of hollow under Elaine's eye and a little bit of shadow, I'm going to try and get rid of that.
She also uses fillers to smooth out nasolabial folds and contour cheekbones, paying special attention to her work.
Another thing that I'm doing while I'm doing the injection is I'm looking at the volume that I'm using so that I know that I'm doing a symmetrical injection.
The finishing touch? A little Botox.
It's going to soften these crow's feet.
When it comes to fillers, Dr. Collins says looking natural is the key.
You want the filler to be put in to restore the normal anatomic contours that are beautiful.
Changes are seen immediately, but it takes a couple weeks to get the full results.
So even though it was just done 20 minutes ago, I can already see just it looks a bit more fresh and full, which is really nice.
A little help that goes a long way.
So women everywhere are turning to facial fillers to smooth out wrinkles, erase under-eye bags, and restore their youthful looks. So if you're wondering whether fillers are right for you, plastic and reconstructive surgeon Dr. Beth Collins is here to explain everything that you need to know. She's also joined by her patient, Christine Hine, who we saw in the video there. Welcome to the show, ladies.
Oh, thanks for having us.
So Dr. Collins, this seems like a pretty good alternative for someone who doesn't want to go under the knife and have a full facelift.
Yeah, very true. So some people don't need a full facelift.
That's true.
So those people, obviously, it's the people who need a little bit more. And I have a couple of people in that video, and there'll be some before and after pictures to show what we can do. It's nice because it's minimally invasive, no downtime, very few complications, low risk procedure. So it's become very popular, and it's also a little bit cheaper than surgical intervention.
Sure.
So in this economy, it's very good.
Something you could do on a lunch break, isn't it? And go back to work?
Oh yeah.
Christine, we saw you in the video. What made you decide to do this?
Well, it actually was a little bit unexpected. I had come to see Dr. Collins originally because I had a spot of basal cell skin cancer right on the side of my eye and needed to have that removed, so that was a bit disconcerting.
Sure.
And was concerned about, of course, the skin cancer and then also the aesthetics of it and the scarring. So I had gone to see Dr. Collins, and she thought that Voluma would be a really good fit for me, and I think she was absolutely right.
You're pleased with the results?
Super happy with the results.
Great. In fact, we have some pictures, so we'll take a look at before and afters, and Doctor, you could kind of explain what we're looking at.
Sure. What I started to notice in Christine was that she had a little flattening in the cheek area just under her eye, and she was saying, and I noticed that it looked a little hollow. So I said, with filling that area and putting the volume back in, it's going to just soften things and be very natural. Christine's young and beautiful. Obviously, we don't want to change the way she looks, but just by putting some volume in there, we've really been able to freshen that area up, and it takes away the shadows under her eyes, so the dark circles that she didn't like are gone, and it takes the eye away from where that scar was by the side of her eye, and,
Sure,
and
you can't
just
even
balances
see it.
everything. You can't see it.
Right.
Yeah.
And Chris, what did it feel like, Christine, when you were getting the injections?
I mean, after the first surgery, I'd had to have the scar removed, or to have this basal cell removed. It was almost, painless.
Pretty easy to go through,
it's
right?
very easy. Yeah, not troublesome at all.
And you're getting married in a couple months. The
yes,
countdown
we're
is
getting
on, so
married,
this might be a bit of a confident boost.
It was a great timing, and it's just a nice, subtle, like I said, fresh look, and I really trust her judgment. and appreciated her feedback about how to best kind of take care of all those things. And
Well, you
improve
look
all
great.
Thank
We have a
you.
couple more before and afters. We're going to take a look at Elaine next, and you can tell us what we were dealing with before and after here.
Okay, so Elaine's a little bit of a different situation. She really didn't like the bags under her eyes, and that's one way to approach it, is to do surgery, but she didn't want to go through that big of a procedure. So I said, let's put some volume into your cheeks and use a little Botox to get rid of the lines on the forehead. So with a combination of Voluma in her cheek area and some Belotero and Juvederm, which are 2 fillers that I use, into the cheeks, just putting volume, you could see that it kind of masquerades those bags that
I mean,
she
she
had
looks
had.
years younger.
Yeah, much better. And the Botox really lifted the lateral brow, this part of the brow, up, so it opens the eye. So a lot of things you could do to sort of manipulate the way the eyebrow is positioned and give a more youthful appearance that's very natural.
Sure. And lastly, we have Ellen, and she had the full facelift.
Yeah. So 7 years ago, we did a full facelift, which included a brow, upper and lower lid blepharoplasty, mid facelift, lower face and neck lift, fat grafting the lips. She really went through a lot. So after that, she comes back basically every year, and we do freshening up. I keep up with the Botox and the filler into her cheek area. And that's the way we keep her fresh looking. And this can go on, she probably won't need any other surgical intervention after that. So the surgery put everything back where it's supposed to be, and going forward we'll keep up that look with the volume.
A little bit of upkeep there.
Yeah.
And you do something called a liquid facelift. Why don't
Yeah.
you explain that to our viewers?
Okay, so part of the facial aging process is a loss of volume. The other part of it is that there's a descent of the tissues, in which case you really do need to go surgically and get a facelift. But if you're somebody who the major crux of your problem is that you've lost a lot of volume in your face, just by simply replacing the volume where it's supposed to be, gives you a major difference. Yeah, and some of those pictures are on the website. We like to keep, for people who are doing injectable stuff, a lot of them are very private about it, so unfortunately sometimes I can't show their pictures, but there are some on the website. But just by putting the volume in the form of these fillers that I have here and other things, these are commercially available fillers that I typically use. One that's new out is Voluma, which gives volume back, and we use it to fill in the cheek area. To fill lines that have come through years of motion of the muscles, we use the thinner fillers like the Belotero and Juvederm.
Great. It seems like there's really an option for everybody, right?
Absolutely, and with a bit of work, you could really give effectively a facelift to the right person.
Very good. Well, let's put that information up on the screen. If you would like a filler or some more information, you could visit BethCollinsMD.com or call 203-689-5295. Christine, good luck with your wedding. It's a fun
Thanks so
time.
much. It was good to be here.
And thanks for all the information.
Of course.
All right.